Hello everyone, I'm Dr. Ashwani. Today we are doing this infected sebaceous cyst removal. ये कब से आपको?
It's been there for 3, 4, 5 years.
Okay, and since when it has been paining?
Yeah, last couple of days.
Okay, ठीक है. So we give a small cut over the swelling and then remove the cyst completely. Okay, now we'll be starting. Hello everyone, so we are starting the case. We make an incision around the lump that we are feeling. And this where you can see the small elevated area, this is called the punctum. So we have to remove this when we are removing any sebaceous cyst. You feel any pain? Let me know.
No.
थोड़ा सा आओ.
So finished removing the cyst. This is the small cavity that is left behind. Now we close this by stitches. So finished with the case. You can see the small stitch line. The stitches, they are very thin in nature, so they don't leave any scars. The stitches will come out on the 7th day. Okay. Sure. So this is the cyst that came out. Let's cut it open and see what is inside. You can see this cavity. So you see there is this putty like material which comes out. There was some pus also which got drained when we were cutting it, dissecting it out. So the pus part of it is already gone. Just this whitish material is left inside. Okay. Back tissues are very tough, so difficulty. Anyhow, you can see majority of it. This is the putty-like material that is majority inside the cyst. The capsule is around it, which we have removed completely. Okay.